In a sea of white coats, what makes a doctor stand out from the rest? It goes beyond training, beyond empathy, to some higher standard that patients and their families recognize. It's a doctor who reaches into heart and soul. They are the singular heroes who did more than their training required, more than their job demanded. Doctors like the ones we honor tonight. The Aubrey Rose Foundation is pleased to announce the 8 Doctors of the Year for the 2023 Above and Beyond Doctor of the Year Awards, recognizing physicians whose dedication, talents, and skills have improved the lives of their patients, with an emphasis on pediatrics for all specialties. All these physicians have exemplified not only a good bedside manner, but the highest of quality care and service. They have all gone above and beyond when it comes to their patients. Dr. Peter Anderson is an oncologist at the Cleveland Clinic. Natalie Stewart is a patient's mother who nominated Dr. Anderson because he truly is a therapeutic alliance, not only for our family, but for many, many Midwest families dealing with sarcoma cancers. There's not a lot of doctors willing to do compassionate drugs or something that isn't written in the protocol. Dr. Anderson weighs the risks and benefits and will color outside the lines if needed. Natalie says, "My son's cancer is very aggressive and I lose hope a lot. Dr. Anderson fights for him. He always responds to my emails quickly. When I requested a virtual visit, he called me that night." It's truly hard to put into words how amazing and deserving Dr. Anderson is of this award. Dr. Christine Hybe is a pediatric ear, nose, and throat doctor who specializes in caring for children who come to Cincinnati Children's for help with sleep conditions and Down syndrome. Dr. Hybe is also surgical director in the Complex Obstructive Sleep Apnea Center. Suzanne says that her son sees Dr. Hybe. Not only has she been able to help us manage his extremely small ear canals prone to infection, but also recognize the low iron levels that he had that were impacting his sleep patterns. We put him through a sleep study and removed his adenoids to help his ability to sleep throughout the night. Dr. Hybe recommended an iron supplement, and that has transformed not only his ability to sleep through the evening, but also ours as well. We're truly grateful she was able to identify a holistic way to ensure that our son has enough sleep to grow and meet his developmental milestones. Dr. Hale Haydarian is a pediatric cardiologist at Cincinnati Children's Hospital Medical Center. Alex's mom says, "It's my honor to nominate Dr. Haydarian from Cincinnati Children's for the Aubrey Rose Foundation's Doctor of the Year Award." Alex was born with a heart defect and at 4 months old had to have open heart surgery to repair the defect, given his failure to thrive diagnosis. The surgery was successful and now he's 8 years old. Dr. Haydarian has been his pediatric cardiologist, taking care of him since after his surgery. Her ability to support his needs and the way she's able to relate to Alex given his special needs is heartwarming. Dr. Haydarian is able to provide us, as parents, the reassurance on the recovery of Alex, yet balance what challenges he may face in the future with his heart valve. Her ability to connect with parents and the patient is truly a unique gift. We're so thankful for the care she provides for our son. Dr. Patrick Ruck is a pediatric dentist at Cincinnati Children's Hospital Medical Center. Above and Beyond suggests that there's something extraordinary about the provider, and there are few providers who encapsulate that more than Patrick Ruck, DDS. Patrick has made a life not only advocating for oral health through clinical care, but also serving the most vulnerable populations. He built his clinical speed and ability to persistently advocate through his time working with the Indian Health Service. During his 2.5 years at Cincinnati Children's, Patrick has distinguished himself as being the go-to person for teens and adolescents with behavioral challenges. This is a very difficult group to engage with, as they often are less welcoming than preschool and middle school children. Patrick has excelled at finding ways to communicate with this population and find common ground. Patrick is motivating. It is an endemic feature of his personality. You cannot help but feel optimistic, and he carries this through to troubled adolescents who have neglected their mouths as a symptoms of their behavioral illness. Patrick is impactful as he teaches residents how to engage, how to problem solve, and be an advocate for the patients that are often forgotten. He has a vibrant voice and puts in hours to help families and children in poverty realize that insurance status or finances should never preclude someone from good oral health. He is an inspiration to those that work with him. Dr. Michael Rudder is a humble and gifted surgeon who changes lives every day at Cincinnati Children's. He works harder than any other human I have ever met to better the lives of pediatric patients around the world. Cindy Pettit from the pre-op team at CCHMC asked a team member to give her an adjective that describes Mike. She actually gave her a noun. He is the GOAT. Cindy would agree that Dr. Rudder is our LeBron James of the airway. Mike is part of the aerodigestive team that cares for complex issues that often come to children from all over the world because of the expertise of the team. Pediatric anesthesiologist at Cincinnati Children's, Ali Candile said, "The day I found out that my son was prenatally diagnosed with Pierre-Robin sequence, I called Dr. Mike Rudder and I asked him for his help. He immediately became the leader of the show that would lead to my son's birth. Rami, my son, would need emergent airway intervention at birth in order to survive. Because of his short jaw and completely obstructed airway, we knew we did not have many options. Dr. Rudder, universally accepted as the preeminent airway expert in the world, laid out the options in a way that my wife, Audrey, and I could understand. It was so reassuring to know that he had taken care of children like Rami before. The plan was clear. We were to have an exit procedure where my son would be born via C-section, and after an incision was made in the uterus, only his head would be exposed. At which point, Dr. Rudder would perform a tracheostomy while he was still attached to the placenta. Once the tracheostomy was complete, then they would deliver him, and he would be taken to another room where Dr. Rudder and his team would properly secure the tracheostomy. It all sounded so complex and otherworldly, but for some reason we felt so safe in Dr. Rudder's expert hands, and we knew Rami had the best chance at a normal life because of his expertise. Despite his undeniable technical skills, measured responses, attention to detail, and compassion for our family are what really stand out. He understands the importance of empathy and made Audrey and I feel heard. Rami has been in the hospital for 5 months, and we will hopefully be home in the next 3 weeks. He's doing fabulous, and we cannot wait to share him with the world." Dr. Christina Tarango is a pediatric hematologist at Cincinnati Children's Hospital Medical Center. Laura Mooney, colleague of Dr. Christina Tarango, said she never ceases to amaze me because going above and beyond is just her baseline. She strives to do whatever it is necessary to provide excellent care and ensure patient safety while encouraging others to do the same. I handle the surgical coordination of her patients. Dr. Tarango developed a note template for surgical planning. This template allows hematology providers to easily develop an individualized plan for surgical procedures that minimizes the bleeding risk for patients with bleeding disorders or patients being worked up for a bleeding disorder. The same-day surgery RN and anesthesia teams at CCHMC love these surgical plans. There's no question what medications or products need to be given and in what phase of care, whether it preoperative, inoperative, or postoperative. Colleague Julie Hendrickson said, "Dr. Tarango represents the pinnacle of pediatric care. Every day, she goes out of her way to provide the best possible outcomes for each of her patients and families. She's never satisfied with a lesser outcome for a patient. Her kindness and compassion are unparalleled, coming only second to her intellect. She is a rare example of what the practice of medicine should look like, and I'm honored and privileged each day that I work alongside her." Dr. Brian Vanderbrink is a urologist at Cincinnati Children's. Patient mom Emily nominated Dr. Vanderbrink. "Dr. Vanderbrink has cared for my 2 children, Bernie, age 11, and Joshua, age 19, who have complex urological conditions. My 11-year-old had a complicated version of the most complex congenital urological condition, and my oldest has spina bifida, many co-occurring disabilities, and an intellectual disability. Both of my children were adopted from the foster care system and had endured substantial trauma. Bernie had severe medical anxiety. He would have intense anxiety, even getting an x-ray, and any surgical procedures led to true panic and horror. Bernie connected with Dr. Vanderbrink almost immediately. The game changer was Dr. Vanderbrink would hold his hand in the OR. It became an expectation of Bernie's that Dr. Vanderbrink would always be there to hold his hand. Dr. Vanderbrink never failed to get there early to hold Bernie's hand, no matter how hard it was logistically. They became quick buddies, and anytime we were at the hospital and passed urology, Bernie would yell out, 'Vanderbrink!' to see if he was there. I, of course, would try to avoid the area because Bernie would get so excited and crazy. Bernie was so excited to see Dr. Vanderbrink that he would insist on having the exam room door open while we were waiting, and he would pop his head out looking for him. Nothing I can say will be able to truly portray what a great advocate, healer, educator, and friend Dr. Vanderbrink is. He is certainly the best of the best." Dr. Susan Wiley is a pediatrician in the Division of Developmental and Behavioral Pediatrics at Cincinnati Children's. Dr. Wiley is also the director of the Thomas Center for Down Syndrome. Alexander's mom shared that he has Down syndrome and he's 8 years old. Since he has been an infant, Alex has been going to Dr. Wiley and her team of PT, OT, and speech specialists to support Alex during his development as a child with special needs. Her expertise and great bedside manner has provided such a strong support for Alex, as well as ourselves as parents. Dr. Wiley and her research colleagues participate in many cross-departmental studies with the Thomas Center for Down Syndrome. These studies have focused on sleep, developmental outcomes for children who have Down syndrome with cardiac conditions, and understanding the best use of medication for mental health conditions. Alexander's mom said, "It is a pleasure to nominate Dr. Wiley from Cincinnati Children's Hospital for Aubrey Rose Foundation's Doctor of the Year Award. Her engagement early on in Alex's development has been a critical part of his great success and his advancements along his developmental journey." So finally tonight, Dr. Susan Wiley joins Dr. Peter Anderson, Dr. Christine Hybe, Dr. Hale Haydarian, Dr. Patrick Ruck, Dr. Michael Rudder, Dr. Christina Tarango, and Dr. Brian Vanderbrink as the Aubrey Rose Foundation's 2023 Doctors of the Year.